Osteoarthritis is a condition which is characterized by degeneration within the affected joint. It is a condition which is associated with aging, but is not an inevitable consequence of aging. If you have a family history of arthritis, you are more likely to develop osteoarthritis yourself. This model of a knee joint shows the normal cartilage lining the knee, and we can see it here in blue on both sides of the joint. In osteoarthritis, this cartilage becomes thinned as it becomes more damaged, and eventually in advanced osteoarthritis we can see that there is degeneration of the cartilage lining the joint, both on the thigh bone side and on the shin bone side. There is also damage to the bone that supports the cartilage at these two sites. Osteoarthritis affects around 10 million people in the UK today and costs the overall economy about £14 billion per year. The knee is the most common site of osteoarthritis and affects something of the order of 25% of patients over the age of 70 years of age. It affects about 1 in 5 of patients over the year of 45, and every year in the United Kingdom around 100,000 patients undergo a knee replacement because their disease has become so severe that they need a definitive treatment for it. The cost of arthritis to the NHS alone each year is around £5 billion, which makes it the 4th largest NHS spend, and the cost of knee replacement alone each year is around £500 million. Osteoarthritis is a condition which is associated with aging, and it is also associated with obesity. Osteoarthritis of the knee does have some associations with certain types of occupations that are very heavy in their manual labour, and occupations that involve a great deal of deep squatting and kneeling are associated with an increased risk of osteoarthritis. Osteoarthritis can also be associated with damage to joints, for example, following a previous break in the bone or the joint. This can result in a secondary pattern of osteoarthritis, that is, osteoarthritis that has occurred as a late consequence of the injury. Osteoarthritis can also occur where the joint has not formed properly during development. An example of that would be developmental dysplasia of the hip. This condition is associated with a significantly increased risk of osteoarthritis in midlife. Osteoarthritis can also occur as a late consequence of infection in the joint. This is called septic arthritis and is common both in early childhood but can also occur in later life. Non-surgical treatments include maintaining an active and healthy lifestyle, reducing weight to being within the optimal body mass index range, physiotherapy, and analgesics or painkillers. Other options as the pain becomes more debilitating include local anaesthetic and steroid injections, which can be administered into the joint and provide some relief from the discomfort, but do not significantly have an impact on the natural history of the condition. And as the pain becomes more progressive, constant and debilitating, then the treatment options become surgical ones. There are a range of surgical options that are available for the treatment of osteoarthritis, and these include realigning the joint so that it takes pressure off the joint and spreads it onto places in the joint where the arthritis cartilage is less severely affected, through to joint replacement procedures where the whole of the damaged joint is removed and replaced with synthetic materials. And examples of these are this is a knee replacement here. We can see that the end of the thigh bone has been replaced with metal, and so has the end of the shin bone. In between these two metal components there is a plastic element upon which they glide. Although osteoarthritis is a disease which is increasingly common with age, there are several steps that can be taken to reduce its impact, such as maintaining a healthy and active lifestyle and keeping one's body mass index within a normal range.